If I could choose one blood marker to predict your long-term health, your disease risk, and how fast you are aging, hemoglobin A1C would be top of my list. I'm Dr. Joanette, and I've been an ER doctor for over 30 years. I'm a Buzo native and the founder of Optimum Health MD. Here at Optimum Health, we focus on helping people shift from normal to truly optimal. Throughout this series of 10 videos, this is the last one, we've talked about how hemoglobin A1C affects your brain, your heart, your muscles, your sleep, your stress levels, and your daily energy. Today, we're going to bring it all together. Hemoglobin A1C is not perfect, and it doesn't tell you everything, but it tells you something incredibly important. What it does is it shows where your metabolism health is headed. We all know that hemoglobin A1C is used to diagnose type 2 diabetes, but what most people don't realize is that by the time someone crosses that diabetic threshold, they have often had 5 to 10 or more years of silent metabolic damage. And during that time, glycation, oxidative stress, inflammation has been quietly accumulating in their body. I've seen this repeatedly in the ER. People come in with a heart attack, with a stroke, with kidney failure, or with nerve damage. And when we look back, their hemoglobin A1C didn't just spike suddenly. It had been creeping up slowly, quietly, and predictably over the last 1 to 2 decades. Your hemoglobin A1C tracks with more than just diabetes. People with the A1C in the pre-diabetic range have roughly the double cardiovascular risk when compared to those with an optimal hemoglobin A1C. And that risk will persist even if their cholesterol and their blood pressure is normal. Dementia risk follows the same pattern. Large studies have shown that people with a higher hemoglobin A1C in their midlife have significantly higher rates of Alzheimer's disease as well as other vascular dementias as they get older. This is due to a combination of vascular damage, impaired insulin signaling in the brain, and also chronic inflammation. Kidney disease is another example. The filtration membranes in the kidney are extremely sensitive to glycation, and as our hemoglobin A1C rises, those membranes get stiff and then they become leaky. Protein begins to spill into the urine and your kidney function declines. Once that damage becomes symptomatic, it is often, unfortunately, irreversible. Erectile dysfunction in men is often one of the earliest signs of vascular damage. The small blood vessels are involved, and they are among the first to be affected by chronic glycation. Many men presenting with erectile dysfunction in midlife have undiagnosed prediabetes or early insulin resistance. Peripheral neuropathy, numbness, tingling, burning, and pain is another downstream consequence. By the time the nerves are damaged enough to cause those symptoms, reversal has become very difficult. So that is why early intervention matters so much. If no one has ever explained how powerful this number really is, hit the like button, subscribe, and then answer this question in the comments below. Did you know that hemoglobin A1C predicted so many symptoms beyond just diabetes? Your hemoglobin A1C is one of the clearest, earliest warning signals that we have in preventive medicine. It doesn't measure one isolated problem. What it does, it reflects the cumulative effect of glucose dysregulation on our entire body. The good news is, though, that your hemoglobin A1C is not fixed. It will respond to lifestyle changes and to behavior. When we improve our sleep, we build muscle. We will reduce our glucose spikes. When we manage our stress and we move every day consistently throughout the day, our hemoglobin A1C will improve. And when our hemoglobin A1C improves, we are not just lowering a number, we are slowing our biological aging. Our energy improves because our cells become more insulin sensitivity. Our brain health improves because our glucose delivery stabilizes. And our cardiovascular health improves because our blood vessels remain flexible. And our immune function improves because our chronic inflammation has decreased. This is why I call hemoglobin A1C a biological aging speedometer. What it tells you is how fast that damage is accumulating relative to your chronological age. People will spend an enormous amount of time and money on all the visible signs of aging, things like their wrinkles, their gray hair, the texture of our skin. And meanwhile, invisible aging is happening inside our blood vessels, the organs within our body, and also our brain. Your hemoglobin A1C gives you a window into that invisible process. At Optimum Health, we believe that feedback is actually a gift. A1C doesn't judge you. It just records the story of your daily habits that you are writing every single day. And you know what? Those stories truly can be rewritten. You don't need extremes. You just need small, consistent shifts that will move the average. Eat slightly better most days. Move a little more each day. Sleep a bit more consistently. Manage your stress more intentionally. All of these small shifts will compound. Your hemoglobin A1C is not your destiny. Think of it as just information. And when you act on it early, you are going to change your entire health trajectory. Thank you for joining me for this series, for subscribing and liking this video, because optimal aging isn't about luck. It is about alignment. For more information, go to my website, growwithdrjoanette.com, and we'll see you next time on the Dr. Joanette channel.